Dr Gareth Williams from Medigold, and Medigold's sponsor of this event. Thanks to them. I think you're going to speak, and Nick Llewellyn's going to sort of press the slide button. Gareth, I think that's how it's going to work. But other than we very much appreciate you talking about what recruiters are looking for. Maybe you want to talk a bit about yourself and how you got into it as well. But over to you, Gareth.
Sure.
Thanks.
Sure. Yeah. Thanks, Nick. Thanks for the opportunity to present today and talk to everybody here. I've only got a couple of slides. Try and keep it reasonably brief. Only got 10 to 15 minutes. So, but the suggestion from Nick was to talk to people about what we as employers may be looking for when we're recruiting for occupational health physicians. I've stuck to physicians, although there may be other OHAs, OHTs or others interested in moving into occupational health. I've stuck pretty much to the remit of what we're looking for as far as OHPs are concerned. I'm Dr Gareth Williams. I'm the medical director at Medigold Health. I've just a very brief potted history about myself. I was a GP after completing GP training. I did GP for about 12 years. And I started dabbling a little bit in occupational health at that time, got my diploma, and then decided GP was not a career I wanted to carry on for the next 20 years. And then moved across to occupational health. Was fortunate enough to be recruited by Medigold Health, where I have been ever since. They put me through my training, helped fund the national training number and my MFOM training and everything. So that's briefly my background. The company's grown over time since I started 17 and a half years ago. Can we have the next slide, please, Nick? Yeah, so who are Medigold Health? Some of you may be asking, some of you may have heard of us. I guess quite a few won't have. We're a nationwide commercial occupational health provider. That means essentially we are non-NHS, and we have a large client base, about 2,500 UK employers of various sizes, from very large corporate bodies, public and private sector industries. For example, we work in healthcare, retail, transport, education, and the media, as well as a number of other industries. And I think one of the attractions to me about Medigold Health when I first started was the variety that we got, and being able to get the various experience from these different client groups. At present, we've got about 150 employed clinicians. It fluctuates a little bit, but at the moment we've got about 50 occupational health physicians, of some part-time, majority full-time. And about 100 OHAs as well as a number of OHTs going out to doing mostly health surveillance. How do you get into working for Medigold Health? What are we looking for? What experience are we looking for? Obviously, I think we all accept that you'd need your basic medical degree. And then what we specifically are looking for is a breadth of experience following the foundation year training, whether that be in general practice, psychiatry, general medicine, or disability medicine. The physicians we've got working for us come from a variety of background. Like myself, there are quite a few who've done general practice in the past. We've got a few who've done psychiatry, a couple have done surgery, stroke orthopedics, and then some who have worked for CHDA, who are the sort of disability assessment physicians working for the DWP. I've put in there that the minimum requirement we usually look for is a diploma level qualification. I'll caveat that by saying that if we're looking, because we are a training organisation, we do have 3 formal training posts, as outlined by Ali. They've got approval from the national school and go through the formal training programme. And the people that come into those training posts need not necessarily have the diploma, but if you're looking to join us and not necessarily looking to develop your career in occupational health up to that accredited specialist consultant grade, we would usually expect people to have the diploma as a minimum qualification. Ali has already mentioned there are some sort of, I've called them special interests here, but there are other certifications or other qualifications stroke interests. The HSE appointed doctor qualifications for lead, asbestos, radiation. Oil and gas industry have a specially accredited course, and then there's the HAV certification as well. So I think what I'm saying there is you need the basic qualification of being a doctor with some broad experience following your foundation years, but then after that, I think we will consider and look at, if you've got extras that you've got on top of that, then that's very helpful in your application towards us. As far as individual skills, what sort of personalities are we looking for and things like that, I've written a few sort of headliners there. We are a busy organisation. We do have a variety of clients, as I've already described, and therefore you will be, you'll need to have your wits about you, getting to understand the different clients and their cultures and demands and things like that. And it does help if people are used to being able to change the way they're working, being able to multitask with different queries at different times. Very useful to have, good decision-making skills and being good at problem solving. Flexibility by that, I mean, pre-COVID, it would have probably meant traveling around the country a little bit, but post-COVID, we are now changing quite considerably in the way we work, and remote working, home working is taking off with us, and we are increasing the amount of remote consultations using tech, video consultations and things like that. So again, some degree of being flexible and prepared to work in different ways is very useful for us. When we're quite happy with people who just want to work part-time, maybe got interest in carrying on their GP work, or other special interests that they may have. I've put education in there. We're quite happy, as I say, we are a training organisation, and look to help and support people with their education and career development. For example, we do have our in-house training program. Part of that would be the induction when people initially start, but also looking at the formal training program, but also helping people with CSER, or just general helping people build their CPD to meet appraisal and revalidation requirements. As I've said already, I think we're looking for people who are quite adaptable, able to work in different situations and different industries. One of the things I think you'll find that most of the physicians that work for us will say is no 2 days is the same. And I think we're always looking for people who would consider to be team players. As I've described already, we've got OHAs, OHTs working for us, and being able to support colleagues, and not only that, be prepared to seek advice from such colleagues as well is something that's very useful. Next slide, please, Nick. Strengths we're looking for. Certainly you need to be able to write clearly in your reports what following the history taking and things like that, what the way we work is we provide reports to management following consultations. So you need to be able to write clearly and with following good, clear guidance and structure to the report with clear opinions, and you need to be able to verbally communicate effectively to different levels of people within the organisation, within Medigold itself, but also within client groups. You're talking to employees when you're interviewing them, consulting with them. There may be trade unions present there, or there may be meetings with trade unions, and HR and board level individuals such as CEOs may want a discussion and an understanding of the medical perspective of certain issues. I mean, certainly with COVID coming on, I know our physicians are being asked more and more to get involved in helping support organisations in advising our clients. Yeah, so clear reporting writing skills. I think I'm of an older generation, and I think IT literacy I've put down there, but I think the majority of individuals these days tend to be reasonably IT literate. The way we work, we are quite flexible in how we prepare reports, for example. I personally use a dictaphone, and that gets typed up by the secretaries. I've got individuals who like to type up their own reports, or will use drag and dictation, for example. So as an organisation, we're quite flexible, but what we're looking for is people who are quite familiar and quite happy to work in a set way. Yeah, I've mentioned already about providing opinions, and I think what we're looking for is people who will provide robust opinions and reports. Yes, you need to remain impartial and independent when providing advice about absence management, for example, and you need to be able to defend what your opinion and your judgment. But what we don't want is people sitting on the fence and giving unclear guidance or advice. I think we do demand quite a bit from individuals. I think people do need to be reasonably self-reliant. Quite often you can be working quite remotely, but with access to supervision and support as needs be. And I think a degree of emotional resilience is also needed. I've put lastly there, inquisitive. I think that goes as a general thing for occupational health physicians. I think if you're looking at the type of work we do, there is nothing like going onto the shop floor to see actually how a widget is made, and then you will see all the sorts of issues and problems there. I've just had a little message come up asking about any difficulties for sessional physicians. We do. It's as an organisation, one of the things that Medigold's particularly strong on is using employed physicians. The difficulties with sessional physicians is you're dipping in and out a bit, and it's difficult to get the supervision and support when you're not in the organisation a great deal. And as I've said before, you can be working quite remotely. Having said that, we do have some people who just want work 1 or 2 days a week. So yeah, we do consider applications from a variety of backgrounds and what people are looking for. Can I have the next slide, please, Nick? I don't think I've much more to say. I'd also say it's all very well me spouting out about what we're looking for, and I'd say to you, in general, if you're looking to move into occupational health and looking to work in occupational health, you've got to find the right organisation that's the right fit for you. I believe that recruitment's a two-way process. I'm speaking from a large, commercial provider background and experience. One of the larger ones in the country, and there are a few others similar size or possibly larger, but there are a number of other organisations as well who possibly work on a more local level, maybe on a smaller basis, and may be looking for perhaps just a sessional physician or something like that. So I'd say, do your background research, look into what you're making sure it fits in with what you're looking for. I've mentioned company values and culture there on the slide is actually Medigold's values and cultures. But I think again, if you do your research and look into what you value out of your career and what you're looking for, and if it's you want a career development, or for example if you want to go into a very academic research orientated, maybe Medigold's not quite for you, because we do formal training and we do help people get their dissertations done and things like that, but if you want to continue in a long-term academic career, I'd suggest perhaps university OH departments may be the better places to look at. I've mentioned career development opportunities. We are a training provider with 3 formal training program numbers from the National School Stroke GMC, and with the size of the organisation, there is also opportunities for sort of leadership development. We do have a sort of regional basis of senior physicians and leadership. I've talked a little bit about training program. We have a very structured induction program. This might cover the employed versus contractor issue. Is maybe covers that question about sessional physicians as well. HMRC, I don't know how many people know about the HMRC IR35, I think it's called, whereby if you're doing regular work on a regular basis for the same employer, there may be tax implications. As a generalization, we at Medigold prefer people being employed. It does mean that there is an element of commitment there, and the ability to provide support and supervision is far greater, I believe. So if you are considering contractor role, I'm not dead set against it. We do have some contractors we use. Just be careful about the HMRC IR35 ruling, and again, do your background research into that. How do you get a job with us? I'm quite happy to take a direct approach. If you want to approach Medigold Health directly, either myself or anybody else you may know at Medigold already. That may upset the recruiters who are on this, but I think, like I say, I'm quite happy. We do offer some shadowing and support. That's probably curtailed a little bit as a result of our face-to-face clinics being considerably reduced as a result of COVID. We had been planning on reopening them up a little bit, but as a result of yesterday's announcements, we're sort of holding that in abeyance at the moment. As I've said, we do have part-time and full-time opportunities regularly coming up. We are a growing organisation. So I think that's the last.
Yeah, thanks very much, Gareth. That's very, very helpful.
Just a quick.
I like the combination of sort of doing the flexibility Medigold offers, and just being honest about what it is. But it is a very interesting career, helping people with kind of really important